My name is Jared Brown. I'm an outpatient physical therapist here at Sharp Grossmont Hospital. I specialize in outpatient orthopedics, ergonomics, and injury prevention for the hospital. There's a few reasons behind why low back pain is so prevalent. Number one, it's the sheer anatomic makeup of our lumbar spines. Our lumbar spine is the kind of connection point between our middle half and our trunk, our thoracic spine, and the lumbopelvic region, or our hips. Those two areas of the human body are very rigid and stable structures. They're meant to be that way for a variety of different reasons. Our hip is the weight-bearing aspect of our entire body, and our thoracic spines have to be rigid and stable to protect all the vital organs that are behind there. Oftentimes what happens is the low back ends up picking up the slack for motion that we might be lacking in one of those two areas. So today we're going to show you a few different stretches to kind of target the lumbopelvic hip region, as well as some of the other muscles that attach into the low back. Again, these exercises are not cookie cutter and they're not specific to just one type of condition. Low back pain is very challenging to diagnose, so it's always important to see your physician first or your physical therapist to get evaluated to make sure that these exercises are appropriate for you. The first stretch that we're going to show is what's called a three-dimensional or triplanar hip flexor stretch. The hip flexors are a group of muscles comprised of the quadriceps muscle group, the iliopsoas, which actually connects onto the lumbar spine, as well as the tensor fascia lata, or TFL for short. So first what we're going to do is we have Mark in a half kneeling position. He has his foot elevated on a box to target a little bit more of the quadriceps group. The motion that we're going to do first is we're going to start in the sagittal plane. So what Mark's going to do is he's going to reach his arms all the way up towards the ceiling, driving his pelvis forward. That's going to stretch kind of more of the anterior portion of the hip. We're going to do 10 in this position. Very good. The next position that we're going to go is into the frontal plane. So Mark's going to do the same thing where he's driving his hips forward, but now with his hands he's going to go side to side. Again, you're going to what is comfortable for you. Start small and then slowly progress. Good. The last plane of motion that we're going to target is what's called the transverse plane. This is the rotational plane. So Mark's going to go into that same position where he starts to feel a stretch. Then with his hands, he's going to rotate all the way to the left as far as he can, and then all the way to the right. Again, performing 10 repetitions side to side of this, and then relax. Good. The next stretch that we're going to show you is what's called a three-dimensional or triplanar hamstring stretch. The hamstrings are a group of muscles that come from the pelvis all the way down and actually attach into either side of the front of the knee. Okay? So the first motion that we're going to do, again, is working on that sagittal plane. So Mark's going to go with his foot up on a box. He's going to take his arms and try to swing his arms behind him as far as he can go to what's comfortable. Good. We're going to perform 10 repetitions of this. So again, it's targeting that hamstring muscle group. The second position that he's going to go in, he's going to be with his foot up on the box. And then now instead of just throwing his arm straight back, he's still going to get to a position where he feels a stretch. But then what he's going to do with his hips is he's going to go side to side with his hips. Good. So he's basically taking those hips, driving to the left. Good. Driving to the right. This is going to target more of that frontal plane motion. Again, 10 repetitions, which each of these is what's recommended. Perfect. Okay, and then the last one, we're going to target that transverse plane or that rotational plane. So Mark's going to go into a position where he feels a stretch. And then with his arms in front of him, he's going to rotate to the right. Good. And then rotate to the left. This is going to target that hamstring muscle in all three different planes of motion that it needs to be in. Good. The last stretch that we're going to show you is what's called a kneeling Latissimus dorsi stretch. The Latissimus dorsi is a very vast, long muscle that actually starts into the low back. It comes all the way up and actually attaches onto the underneath of your arm. A lot of times that muscle is really tight from sitting in these kind of protracted positions for prolonged periods of time, and a lot of times we don't stretch it. So we're going to show you that here next. All you need for this one is something to hold on to, whether it's a stick or a broom handle. It's going to basically keep your arms apart, and then a chair. And as long as you're okay being on the knees, you can always have a pillow underneath to kind of support that area as well. So Mark's going to go where his elbows are going to be onto the chair. As you can see, he's grabbing this dowel with his palms facing himself. Okay, we want that because we don't want the arms being over here. That will actually cause the lats to go into a little bit of a slackened position. We want to tighten them up as much as we can. As Mark sits back, he's going into a little bit of flexion through here. That's also going to start to tension the lats. Dropping his chest down into the ground will give him a little bit more of a stretch, and then you want to maintain this stretch for around 30 seconds. So again, sometimes taking deep breaths in, exhaling in the stretch will allow you to kind of sink into that stretch a little bit more. It's always recommended to do 2 to 3 repetitions of 30 seconds when you're performing a static or a held stretch. So thank you for watching these 3 stretches for low back pain. But always remember, if you're experiencing any form of low back discomfort, it's always important to get assessed by your primary care physician or your physical therapist before attempting any of these. Some of these stretches could potentially make your symptoms worse. However, always double check and make sure that you're doing what is correct for you.